Ladies and gentlemen, welcome. We will reconvene the House Health Subcommittee that began Tuesday, March 26th, the year 2024. It is Wednesday, March 27th, the year 2024, for a continuation of the recess motion we had for House Health Subcommittee yesterday. Ms. Adams, could you please call the roll?
Representative Hicks.
Here.
Representative Jernigan. Representative Leatherwood. Representative Martin.
Here.
Representative Mitchell. Representative Sherrill. Here. Representative Terry.
Here.
Representative Williams.
Here.
Representative Hawk.
I'm here.
You have a quorum.
Chair detects a quorum. Thank you, everyone, for coming back today. We do have a handful of bills before us today that we will be taking up. At the moment, it looks like we're going to be taking those up in the order in which we left off yesterday. Do we have any personal orders from any committee members before we begin? All right, seeing none. We are ready to call up item number 27, House Bill 2269 by Chairman Boyd. Do we have a motion? We have a motion. We have a second. Chairman Boyd, you are recognized. I think we have several amendments to go forward, and we'll entertain those as you present those to us. You recognize Chairman Boyd.
Thank you, Mr. Chairman, committee. The first amendment, Mr. Chairman, that we're going to be taking up is Amendment Drafting Code 17254.
Okay. And I will suggest for the committee members, as you go to your dashboard, we are still working off the dashboard that indicates Health Subcommittee from Tuesday, March 26, year 2024. So you will be finding these amendments. If not in your amendment pack, they will be on dashboard that you can access through yesterday's calendar on the subcommittee. All right. We are presenting, give me that drafting code one more time, Chairman Boyd.
And that is 17254.
17254. Do you have a motion? We have a motion. We have a second. Let's go ahead and place the amendments on the bill, and we'll give you an opportunity to discuss it. It's full at that point. All those in favor of placing amendment drafting code 017254 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended with that one. You recognize for further amendments.
Thank you, Mr. Chairman. Amendment Drafting Code 17348.
We have before us again drafting amendment code 017348. Do I have a motion? We have a motion. We have a second. All those in favor of placing amendment drafting code 017348 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended with that one. You're now recognized for a third amendment.
Thank you, Mr. Chairman. That's Amendment Drafting Code 17417.
All right. Ladies and gentlemen, we have presented to us amendment drafting code 017417. Do we have a motion? We have a motion. We have a second. All those in favor of placing amendment drafting code 017417 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We have three bills placed on your amendment, and we are ready for discussion of the bill. You're recognized, Chairman Boyd. Forgive me, Chairman Williams, you're recognized.
Thank you, Chairman. I was just wondering what the parliamentary procedure was for all the amendments that were filed. I noticed that we did skip to amendment number 3, I think, and adopted 4, 5, and then there seems to be 2 other amendments on there, and then the first 2 original amendments. Just wondered what the posture with those amendments would be to make sure that they were maybe withdrawn or rolled to the heel for the purposes of making sure the action of the body is not changed after.
Thank you, Chairman Williams. The posture in the subcommittee, unlike what occurs on the floor, House floor, the subcommittee has the latitude to take amendments up that the sponsor would like to go forward to make the bill his. We have discretion to go back and consider any amendments that are in the amendment pack should we deem necessary. Notice that you do have an amendment that is the amendment pack that is available to us should this committee want to go forward with those.
Thank you, Chairman. I appreciate
You
your
recognize.
patience. So the procedural vote would be to, as we have adopted these amendments, have a discussion about it. And then prior to voting on the bill, other filed or timely or other filed or timely or untimely filed amendments then could be considered at that time.
That is an accurate statement.
Thank you very much.
Thank you. Any further questions? Okay. Seeing none, we will go to Chairman Boyd for description. You're recognized, sir.
Thank you, Mr. Chairman and committee members. House Bill 2269 is a pretty simple bill. Cleans up a section of statute regarding certificate of need in the state of Tennessee. I'm joking, of course. This is a very complex bill, Mr. Chairman. And before I get into the details, I think we do have some folks that want to testify. If you would like to have them testify, I'm happy to do that, or I can go ahead and get into the nuts and bolts of the bill.
Chairman Boyd, why don't you go ahead and get into the nuts and bolts, and then we will, we do have several folks that would like to speak on the legislation, but if you could give us an idea where we are, the posture of the legislation with your amendments at the moment, Chairman Boyd.
Thank you, Mr. Chairman. So members, I don't know if you know this, but a few years back, a certificate of need working group was established, and we started meeting with all the different stakeholder groups that provided various services, hospitals, physicians groups across the state, and listened to their concerns that we had regarding the reform and possible repeal of certificate of need in the state of Tennessee. And so the working group came up with a report. I think all of you have had a chance to look at that. And what this piece of legislation is, it encompasses a good portion of what the working group came up with, but it also compromises with the some of the different stakeholder groups, the Tennessee Hospital Association that had some concerns. We've made some changes to accommodate them somewhat. And so this piece of legislation, just to kind of break it down for you, there are certain things that the working group decided needed to stay under certificate of need pretty much permanently. And bear with me as I dig through my notes here. There it is. Okay. So the working group decided that rehabilitation hospitals, home health care agencies, with the exception of the EEOI CPA and pediatrics, hospice, methadone clinics, and nursing homes would stay under certificate of need statewide. In states that have done full repeal, they have gone back and put these under there. We feel like that they're very unique because of their highly regulated by CMS, because of potential elderly abuse and obvious reasons for methadone clinics. We decided that they need to stay under there. So statewide, they would remain under certificate of need. We also, if you'll remember, there used to be a carve out for distressed counties. Any counties in the state of Tennessee that were considered distressed were basically considered non-CON counties. Anything and anyone that wanted to go in there and provide a service or build a hospital was allowed to. We have expanded that to include any county that does not have a licensed acute care hospital. So that's another change that you've seen. And then everything else, I'll kind of go through here. And so what would happen is July the 1st of 2025, freestanding EDs would come out from under certificate of need unless they were within 10 miles of a competing hospital. Now, per federal guidelines, they can't be more than 35 miles away from the host hospital, but you could build one anywhere that you wanted as long as it's within that 35 miles, so long as you're not within 10 miles of a competing hospital. And that would apply both in the CON counties and the non-CON counties. In December the 1st of 2025, burn units, neonatal intensive care, immediate care facilities for individuals with intellectual disabilities, positive emission tomography, PET, and MRI would come out from under certificate of need and would be moved over to licensure. And then December the 1st of 2027, ambulatory surgical centers, linear accelerators, and long-term care hospitals would then come out from under CON. And then the final ones would come out December the 1st of 2029. That would be open heart. Some things that we are leaving under certificate of need for CON counties would be cardiac cath and outpatient diagnostic clinics. Those you would still have to have a certificate of need to have one unless it was in one of the non-CON counties that doesn't have a licensed acute care hospital. And acute care hospitals are also left, they will remain under CON with the exception of that carve out for the counties that don't have anything in them right now. And so, Mr. Chairman, that is basically the high level view of what this bill would do. I can take any questions or we can hear testimony, Mr. Chairman.
Thank you for the explanation. Forgive me, the allergy season is upon us all. So where's the doctor of the day when you need one, right? Any questions of the sponsor before we go out of session? We don't have your name at the moment, but are you by chance an ear, nose, and throat especially? Okay. We're talking about scripts that we might be able to get for this, so thank you very much. The move of the committee to ask any questions at the moment, or would we like to go out of session and hear from folks who would like to present to us? I think the will of the committee is to go out of session at this moment. Without objection, we are out of session. We have several folks that would like to speak. We'll begin with James Ross from West Tennessee Healthcare. Okay, I'm told that no one is here by the name of James Ross from West Tennessee Healthcare. We have Stephanie Wise with TriStar Health. Stephanie Wise with TriStar Health here. Okay, we have Angela Odom, citizen from Carter County on the list. Is Angela Odom here? Okay, there she is. If you'd like to come up, feel free to, you can sit at wherever you're. Okay, if you're comfortable there, that'll be fine. If you could, there'll be a button on there that's got a little face, a speaking face. You can ensure that it's red and tell us who you are, who you're with. You'll have 3 minutes to express your thoughts and then potential for follow-up with any committee members after that, but you're recognized. Please, again, tell us who you are, who you're with, and you're recognized.
Okay, my name is Angie Odom, and I'm the founder and director of a crisis pregnancy center for 24 years, actually, and I am a Carter County, Tennessee County Commissioner. I'm a wife, a mother, a nana, and I'm raising my niece, and I'm old. I'm in favor of this bill because I stand for life and for health for everyone. Our crisis pregnancy center has a Mommy Mart program, and right now in our small county, I have over 400 clients. Our county's birthing center was closed, and now we also lost our ICU. In a rural area, Carter County also served Johnson County, which is our neighboring county, and they depended on our town services at our hospital. The problem is that medical services are very limited, and I personally know this, and that's why I have to travel from Nashville to Knoxville to South Carolina in order to receive the proper care for my child. At least 80% of my clients have transportation issues. We do not have any public transportation. That means if care is not accessible locally, it's very difficult for them and their children to get the care. A large percentage of my clients don't even get regular health care, including prenatal care. Just a few weeks ago, my brother-in-law even passed away from a cardiac issue. The ambulance services were tied up because now they have to go to other counties in order to take patients with any kind of critical care because our ICU is no longer in our county. He waited for 45 minutes for an ambulance while receiving CPR. The ambulance had to stop at our local hospital in order to get him stable. There, he was then transferred again, manually ventilated, since those services are not permitted at our hospital. He later passed away. As an elected official, I have heard the needs of our community through phone calls, emails, and signatures, which I can provide if you ever need them. As a crisis pregnancy center director, I've been challenged to deal with these community issues. And according to data received from 2000 to 2022, Carter County has lost $1,198,000 in denied health care projects because of the Tennessee CON laws. CON restricts the supplies and drive up prices. And I know from seeing families daily in court who are struggling to pay their medical bills instead of being able to provide their daily electricity and rent bills. I plead with you to pass this bill. Please don't stand in the way of our children and loved ones to have proper care. This is truly a life or death issue. I know you care about the lives of Tennesseans in my county and statewide, or you wouldn't be sitting here today to hear from the voices from the community. And we need your support on this reform. We should not deny any Tennesseans life-saving health care or the right to provide life-saving health care. Why is it that the one thing that can save lives, we always put limits on? I thank you for your time today.
Thank you. And you hit just under 3 minutes. Thank you. Any questions or comments for the presenter? Ms. Odom, thank you very much for being here. We appreciate that. No one else is on the list. We are back in session and ready for debate and conversation on House Bill 2269 as presented. Any questions or comments from members of the committee? Chairman Williams, you're recognized.
Thank you, Chairman Boyd. Thank you for your hard work on this. I know you've been an integral part of the working group over the summer as it relates to the discussion regarding CON. In the time I've been here, we'll say, this has been a subject matter that has been discussed ad nauseum in a lot of ways. I do think the bill, as you have amended, is a good method that's good for healthcare across the state, regardless of whether you're in a large metropolitan area or a small rural hospital like the one that I have, with the idea that through licensure we can help better understand, not just have a free fall from what we had previously before. But I just want to take an opportunity to tell you thank you. I know you've worked diligently in this space, and we used to joke about how little we knew about this 4 or 5 years ago, and unfortunately we've gotten a baptism about it. But I want to take the time to thank you for your leadership and your hard work in regard to this matter. Thanks.
Thank you. Any further questions or comments? I will say a few things. In the repeal of CON has been on the table for many, many years, and it's been in great conversation throughout this Health Committee and Health Full Committee, both in the Senate and the House, for quite some time. In my opinion, I would have liked to have seen this legislation go further. I understand where we are in terms of negotiation with the Senate and what we feel we can actually pass as a body in the House. I would have liked to have seen this bill go further. Many districts, most districts across the state of Tennessee, your hospitals and your hospital systems are, in many cases, the glue that holds your communities together, are beloved and such an inspiration to our communities. And I wish I could say that about my health system and my hospital system in Northeast Tennessee, but unfortunately, Ballot Health has become a source of division in our region that has been very frustrating to myself and many constituents in Northeast Tennessee. And I would love to see that division go away. More specifically, one of the divisive issues that has come about was a circumstance that I had to endure personally from the president and CEO of Ballot Health, Mr. Alan Levine. It's been well documented in the media, and I will not go down that road. But I've challenged board members within Ballot Health specifically to do the right thing and try to move healthcare forward in Northeast Tennessee in a better direction. And in my opinion, personally, I think that needs to begin with the request of resignation of Mr. Levine as the president and CEO of Ballot Health. I've heard from hundreds of individuals who have read media reports recently, and they are all in support of that initiative. Again, I'll leave the challenge to the board members of Ballot Health to go forward and see what their response will be. Any further questions or comments for the sponsor of the legislation? Seeing none, are you ready to vote? All those in favor of sending House Bill 2269 to full Health Committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman, committee.
Thank you. We are now on item number 28 on our calendar. We will pull up item number 28, House Bill 2318 by Chairman Williams. Chairman Williams, you are recognized, sir. You have a motion? You have a motion, you have a second.
Thank you, Chair.
Are you prepared to present your bill?
And thank you, sorta. I think I was so engulfed with the 73 amendments on the last bill that I forgot that I was actually next. So I appreciate your patience. I do have an amendment, I think, that we want to put on.
Yes, we
Chairman.
have amendment drafting code 016712.
Yes, sir.
All right. Let's
I
go ahead
move
and
the
place the amendment drafting code 016712. Do we have a motion? We have a motion and we have a second. Let's go ahead and place the amendment on the bill and place it there for discussion. All those in favor of placing amendment drafting code 016712 on the bill, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill is amended.
Thank you, Chairman and members. I think I've presented this bill inappropriately. That's the third time. I think the first time was trying to put the amendment, so I appreciate your patience, Chairman. This Chairman and committee members, this bill I'm bringing on behalf of the Tennessee Medical Association Coalition for Collaborative Care and with support from the Tennessee Academy of Physician Assistants, who have all worked collectively together to try to find a compromise as it relates to this hybrid model team-based care legislation. This bill has been debated numerous times in many different side rooms, and no one ever got mad, which is, I'm just kidding. And but I will say this bill does not have anything to do with advanced practice nurses. This is only between PAs and physicians. But in a nutshell, this amendment strips out APRNs, which is at the request of the Tennessee Nurse Association as it relates to scope of practice. This bill creates more autonomy for endorsed PAs who have over 6,000 hours of postgraduate clinical experience, which will help increase the ability for us to provide care and care options across the state. Furthermore, this bill brings flexibilities to PAs, ability to prescribe both Schedule 3 through 5 controlled substances. It lays out a specific scope of practice for PAs, including diagnosing and treatment of healthcare-related issues. It allows PAs to perform minor surgical procedures and allows a PA to assist a physician for a level 2 or 3 office-based surgery. Nothing will change for PAs with less than 6,000 hours of postgraduate clinical experience. And as I said at the beginning, this bill does not include any language as it relates to APRNs. And with that, Chairman and members, I'm happy to answer any questions you might have.
Thank you. We do have a couple of folks that have requested to present if the members so deem necessary. Presentation. Okay. We do have a couple of folks on our list. We have Ms. Julie Griffin with the Tennessee Medical Association. And we have Catherine Moffitt and Marie Patterson with the Tennessee Academy of Physicians Assistants. We'll have everyone come forward. At the moment, we will go out of session. And we will let you decide who would like to go first.
Yeah, I'll go first.
And we will begin by you introducing yourself to us, telling us who you are, who you're with, and what you'd like us to know. We have 3 minutes for each, and we'll have an opportunity for rejoinder whenever we get to that point. Ladies, whoever would like to go first, you're recognized.
I guess I drew the short stick. So Catherine Moffitt with the Tennessee Academy of PAs. And the Tennessee Academy of PAs is pleased to join with the Tennessee Medical Association in support of House Bill 2318 as amended, including amended language expected from the department in the full health committee, which will address some minor enforcement concerns that they have with the bill. This bill represents years of discussions, work, and negotiations between our two organizations. It doesn't give us everything that we had hoped for, but it does move our profession forward and make meaningful change to PA practice in Tennessee. Changes that we hope will streamline and improve collaboration with physicians and provide much needed access to care for Tennesseans. Upon adoption of this legislation, we have agreed to a moratorium with the TMA to refrain from filing Practice Act legislation for the next few years. This moratorium agreement is contingent upon how future legislatures amend certain practice acts for other professions, which may impact employment opportunities for PAs. I would like to thank Chairman Williams for carrying this bill, and I hope the committee will vote it out with a favorable recommendation. And then I'm happy to answer any questions following the TMA statement.
Thank you. Ms. Griffin, you're recognized. Tell us who you are, who you're with, and what you'd like us to know.
Julie Griffin, is it on?
No.
Julie Griffin, Tennessee Medical Association. Mr. Chairman, members of the committee, thank you for allowing me a few minutes of your time today. I am proud to testify along my physician assistant colleagues in support of House Bill 2318. I want to thank TAPA for working with us to attempt to make the system better while keeping in place provisions that are good for patient safety. For more than 10 years, I have heard that TMA is not willing to compromise. I hope this collaboration proves otherwise. The nurses have asked to be removed from the bill. This is very disappointing. TMA does not want to put this committee in the middle of another fight. Therefore, we have heartily agreed to support the change. But why did they want out of the bill? They have told me directly that it is because they do not want their scope of practice in statute, something that this committee does for every other healthcare profession. Currently, APRN scope is defined by protocols and formulary that their collaborating physician approves. That determines what expertise and demonstrated competency the APRN has performed is proven to be safe for patients. What concerns me is that now we know that APRNs not only want independent practice, but they don't want a defined scope of practice like every other healthcare professional. They want to leave it to their education and training. Does this mean a weekend course to do a major surgical procedure? We know that not all APRNs get the same training from program to program. We know that there are just some things that should be performed by a physician or at least under the eye of a physician. The PAs sit here today wanting to do the right thing for patients while at the same time making things better for their profession. TMA is here doing the right thing for patients while doing the same by attempting to make things better for advanced practice professionals they work with. Where are the nurses? They're on the sidelines so they don't have their scope of practice limited. As a patient and as an advocate for patients, it concerns me, and I hope it concerns you as well. That being said, I hope you support this bill, which will move TMA and TAPA forward in making the system and the professionals work better moving forward. Thank you, Representative Williams, for carrying this bill and for being an advocate for patients. Thank you, Mr. Chairman, and I'm ready to answer questions if there are any.
Thank you. I will note that these are the only individuals with interested parties who are on the list. There is no one else that has requested. I'll leave it at that. Representative Martin, you're recognized.
Thank you, Mr. Chairman. I want to thank you guys for working together and coming together for the betterment of all Tennesseans. I have Bethel University that I've spoken to a lot with a great PA program, and I know they are very appreciative of the work that's been done. In my short 2 years, I've heard it often of how we're trying to work together, and thankfully you guys are there. This will benefit all Tennessee, especially us in rural West Tennessee as well. So thank you all for your work. Look forward to this moving forward.
Thank you. Any further questions while we're out of session? Seeing none, thank you very much. We are now back in session. Without objection, we will go to Chairman Williams. Any further comments or questions from the committee?
Just ask for a favorable vote. Thank you, Chairman.
Any questions or comments from members of the committee? Seeing none, hearing none, are you ready to vote? All those in favor of sending House Bill 2318 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. As we are waiting for some other presenters to come in, we are going to go to item number 31 on our calendars. Item number 31 by Representative Garrett. You have a motion. You have a second. You are recognized, sir, on House Bill 2720.
Thank you, Mr. Chairman and committee. I appreciate your indulgence. And to quote my great colleague from Cookville, you all, this is the full CON bill, which you all have heard CON ad nauseum over the past few weeks, I'm sure. But let me tell you why I believe this is an important piece of legislation, going forward. My county is not too far from here. I mean, I'm from 18, 19 miles away. I grew up around 7 or 8 hospitals. So I never really had the issue of where we were going to go for a hospital, given that we have hospitals here in Nashville. And I've got 2 hospitals, at least back then, in Sumner County. Now we have more. The 2 largest cities in my county is Hendersonville and Gallatin. So the reason why this has gotten to my attention, the reason why I've kind of dove in neck deep with this, is that the hospital in Hendersonville wanted to get a freestanding ER in Gallatin. They went through the CON process and they were denied. In fact, the CON folks said that you can put this over here in a residential area with no commercial property and it'd be fine. That kind of was curious to me because I supported that move for a freestanding ER in Gallatin because there's only one ER in Gallatin, and Gallatin is a growing city. In fact, 10 or 15 years prior to that, the same hospital in Gallatin decided to put a freestanding ER right close to my office, right close to the hospital in Hendersonville. And that hospital didn't oppose that. And it works beautifully. That freestanding ER is great, has a cancer center next to it. It serves the public. And my concern over this is that if we have a dermatologist, a chiropractor, a dentist, that they want to come to a community, then they've got to go ask their competitors to say, hey, I want to open up a dental practice. Then the government's got to put its state tentacles into it and say, well, wait a minute, you don't really need to do this because is there a need? And I would tell the folks that are dentists, that are lawyers, or anyone else that practice in a particular area, if there's a city that has 5,000 people, there's not going to be 15 dentists. The market's going to take care of that, right? We are a free market society. I believe in the free market society. And same thing with hospitals, same thing with the industry. The industry has to adapt. I don't see hospitals being built all across the state and all across the country. Why? Because more things are coming to the community. Vanderbilt's got a fantastic cancer center a mile from my office in Hendersonville. You see St. Thomas or Ascension now coming to the community with doctor groups, et cetera. They're not going to build additional hospitals because that's not meeting the need of the particular communities. And why is it government's role to determine what that particular need may be for a community and the health services that they provide? Isn't it the market the best place to figure that out? So with what happened in my district, that I'd have to say it upset me when I wanted the folks, even though Gallatin's not part of my district inside my county, it still made me concerned that those that wanted an alternative to the only ER there, it was denied. And it wasn't denied by the community itself. They had to come to Nashville, go in front of a board. It's a bureaucratic board to say whether or not they could have the services that I think would provide competition. And I know there's some apples to oranges comparison when we talk about certain things in the healthcare world. It's an odd industry that we have, how it's regulated, how the competition festers inside that industry. But I think the industry is going to have to adapt just because we are not flooding markets with new hospitals. It's different forms of services that are coming to our communities, and they don't need our government saying, whoa, we don't need this. That's up for that community to decide, for the market to decide, for what services in their healthcare they can provide. So, Mr. Chairman, you've been very well to let me go on this speech today to talk about why I believe full CON repeal is important. I do appreciate the working groups. Chairman Boyd has done a great job. That's been a part of that. I plan on supporting that bill if it continues on from full and forward there. But I think this is a real consideration, a great step forward. That bill, Chairman Boyd's bill, is a great step forward. But I hope one day we can look at this full repeal in the future because I know that it would help the citizens of this state reach the health care and the access they need. And so since this bill may not be moving too much further, I would like to, if the committee's purview, take this bill off notice, but I just want to let you know my thoughts why this is an important piece that we should continue to march towards fully repealing the certificate of need in this state. So with that, Mr. Chairman, I'd be happy to take any questions, but I do intend to take this bill off notice.
Thank you. Thank you very much for your comments and your passion about this issue. As you've heard, some passion from other members on the committee as well. Any questions or comments for the bill sponsor? Your request will be granted. Without objection, House Bill 2720 by Representative Garrett will be taken off notice without objection.
Thank you, Mr. Chairman, and your indulgence committee.
Thank you very much. We are now back on our calendar. We were awaiting communication from Chair Lady Littleton on item number 29. Item number 29, House Bill 2933. The request has been from Chair Lady Littleton to take this bill off notice. Without objection, House Bill 2933 by Chair Lady Littleton is off notice. We will now go to our special calendar. And it's special because it's also Chair Lady Littleton is on that calendar, and she's such a special lady. We thank her. The request from Chair Lady Littleton on House Bill 709 has also been to take this bill off notice. Without objection, House Bill 709 by Chair Lady Littleton is off notice. As we double check our paperwork from the chair, ladies and gentlemen, Chairman Williams, you're recognized.
Thank you, Chairman. I wanted to beat you to the punch before you start talking to landing the plane, but I did want to take an opportunity to thank the chairman for his leadership and his hard work. I know having Chairman Williams on your committee, it makes it much more difficult. But I appreciate your patience, your diligence, your hard work this year. You've done it. You've ran a great committee, and you and your staff are to be commended. So just wanted to say from me and from the rest of the committee.
Cut yourself back on.
Chairman, I withdraw my my kind remarks.
Just for the folks listening in, I accidentally hit the wrong button trying to clear a piece of lint off that. Actually, I was beginning to blush at some of the comments that Chairman Williams was making. I'll know how sensitive those buttons are going forward now. I do want to thank all the folks who've been associated with this subcommittee. We have dealt with some very intricate details and very deep issues in this particular subcommittee this year. And I think the diligent work that the committee has had, I think you've done tremendous work. I appreciate the confidence that has been placed in this committee to do the good work that's been done. Couldn't begin to say we do any of this work without our research analyst, Mike Critchfield, Caroline Miller, who works in legal staff to ensure that we're getting all the work done. My legislative assistant, who I affectionately term the boss. If you call the office, she's the boss. If by chance I do something right, it's because Shelley Adams asked me to do something right. So she's the one who runs the office and ensures that we get some work done. Folks from the clerk's office, Coach, our sergeant at arms, who's been here taking care of us for all these weeks now. I appreciate the work that you've done. Any further questions or comments from the subcommittee? Seeing none, we are adjourned, subject to call of the chair.